Indian tobacco, also known as Lobelia inflata, is a significant medicinal plant, renowned for its broad therapeutic applications and striking features. This herb has been utilized in traditional medicine for centuries, addressing a range of health issues predominantly related to respiratory and neuromuscular systems. Other names: Indian tobacco is alternatively known as pukeweed, asthma weed, gagroot, and vomitwort, reflecting its diverse uses and potent effects. Growth and habitat: Indian tobacco is native to eastern and central North America, thriving in open woodlands, fields, and roadsides. It prefers well-drained, somewhat acidic soil and is often found in transitional areas between cultivated lands and forests. Identification: this plant is characterized by its small, delicate flowers, usually pale blue or violet, and its inflated seed pods, which give it the name inflata. It grows as a spindly stalk with sparse leaves, reaching heights of 30 to 90 centimeters. Edible parts and use. While not typically consumed for its flavor or nutritional value, the leaves of Indian tobacco can be used sparingly in culinary practices, primarily for their potent effects rather than taste. Medicinal parts and uses. The medicinal components of Indian tobacco include its leaves and seeds, which are harvested for their use in powders, tinctures, and extracts. The plant is highly esteemed for treating respiratory ailments such as chronic bronchitis, asthma, pleurisy, and pneumonia. It acts as an expectorant, helping to release phlegm and ease breathing. Further, it supports individuals trying to quit smoking by mimicking some of the nicotine's effects, thus reducing dependency. Its use as an antidepressant and for treating anxiety disorders, dysthymia, eating disorders, obsessive-compulsive disorder, OCD, and depression highlights its impact on the central nervous system. Additionally, Indian tobacco is beneficial for relieving body aches, muscle pain, joint pain, and minor skin irritations. Its ability to relax the neuromuscular system can be utilized to induce vomiting, which helps in detoxifying the body in certain traditional healing practices. How to harvest. Indian tobacco should be harvested when the plant is in full bloom to ensure the highest potency of its medicinal properties. The leaves can be dried and powdered, while the seeds are collected as the seed pods begin to open. Cautions. Despite its medicinal benefits, Indian tobacco is highly toxic in large quantities. It should be used under professional guidance, as excessive use can lead to nausea, vomiting, severe respiratory distress, or even death. It is not recommended for use by children, pregnant women, or those with a known allergy to the plant. Conclusion: Indian tobacco, with its complex profile and potent medicinal benefits, remains a plant of great interest in both historical and modern herbal medicine. However, due to its powerful effects and potential toxicity, it should be approached with informed caution and respect. Utilizing this plant requires a careful balance to harness its benefits while mitigating risks, embodying the dual nature of many traditional remedies.